Faith Selchick is whom I nominated because I met Faith about a little over 7 years ago. And I think she is the epitome of what you folks are looking for. She meets all the requirements to qualify for the CARE Award. And, I know what C stands for, the A stands for, the R for resilience, the E for emotional intelligence, which she has. And, she is truly a good combination of someone who is compassionate, who's caring, who's extremely knowledgeable, very intelligent, and yet very resilient and resourceful in coming up with solutions for individual problems and in a macro sense, looking to see how we can expand cancer care here in the community, in the cancer program, and in our local community in Rockland County and Orange. So as much as I think, and I look to see some of the previous finalists in prior years, I know this is the third year. I've done my research, I do my homework, and I also know who the previous individuals were who won the awards. I do think it's time to get someone out in the community. Because as I have said, most cancer care in the US is out in the community. And so that's not to knock the academic ivory towers. I've been there myself. They do very important work. But I think what we do out in the community is equally important. And that's where 80 to 85% of Americans get their care. So I think Faith kind of epitomizes what you folks are looking for as as a role model. And she kind of lives that in terms of I see how she interacts with our oncology nurses. I see how she interacts with hospital administration. So if she brings in her administrative kind of chops to the situation where she is far better equipped than some of us physicians in perhaps dealing with administration, which is really good to see because physicians have a certain way of dealing with administration, and I think she is able to soften that approach and do it in a manner that is very conducive to growth. And so I think she is a prime candidate to receive this award, and I sincerely hope she does, because I think she meets everything that you folks are looking for. It is crucial for the oncology community to recognize the important work that the oncology nurses do. And I think we do. But I have seen it grow over the years. And I have to tell you that for me, I have been working with oncology nurses right from the beginning. So I truly appreciate everything that I do. But now when I go to conferences and, I attend a fair number of conferences and stuff during the year and talk to my colleagues from across the country, I see more and more, my colleagues, the physicians, the MDs, are so much more reliant and open to the concept that it's a team approach. It's not just the MD making the decisions. You've got to get the other members of the team involved in making the right choices for your patients.